An active lifestyle demands healthy legs, but vein disorders can actually slow you down. Dr. Robert Cutchen, founder and director of the Albuquerque Vein and Laser Institute, is back to tell us how we can learn to love our legs again. You know, I always say I would love that. Right. I gotta hide it with my boots. So tell us, what is a varicose vein for those who have missed it in the past?
We talk about this every time, but it's important to really understand it because it's kind of confusing. And the important thing to understand is first the job of our veins.
Okay.
And I've sent a couple graphics over to help us understand that. But it's important to know that the job of your veins from our legs is to get the blood out of our legs back to our heart.
Right.
The blood should only flow up. And inside of our veins, we have these little valves, these little leaflets you can see. And the blood flows up when we squeeze our muscles. But gravity's always fighting against us. And gravity's going to pull that blood backwards. And as soon as that happens, these valves snap shut. And that prevents the blood from flowing right back down towards our toes.
And there's really nothing we can do about that. Gravity is gravity.
Gravity is gravity. It's evil in so many ways, isn't it?
Yes, it is.
Well, when our valves are working right, everything's dandy. But in a varicose vein, these valves are broken, and the result is that gravity wins. The blood flows right back down that vein, backs everything up. That puts a lot of back pressure and congestion in that vein, and that's what causes some of the veins to bulge out, and what really causes a lot of the symptoms of varicose veins is that backwards blood flow.
So that's the cause. What are the actual symptoms themselves?
So for most people, it's symptoms of your legs feeling heavy, feeling achy, feeling tired. Some people have a lot of burning or itching or throbbing in their legs, and it's kind of different for every person, but it's just, the phrase I always use is that heavy, achy, tired feeling.
Now, does the weather affect that? Because I noticed, you know, when it's a little more humid, a lot of people complain about that. So will you tell people if weather has anything to do with it?
I don't think it's a huge contribution. A lot of people say their veins feel a little bit worse in the summer, and I think that's because heat makes our veins dilate. That's part of the way our body cools itself. So maybe a little bit worse in the summer, but not a big player.
But it's not a big player. Okay, well, that's good to know. Now, okay, so let's say somebody says, okay, yes, I have the symptoms. The causes make sense to my life. So now I need to know what to do next so I can treat this. So what would the treatment be for varicose veins?
The good thing about treatments is that everything is done in the office now. So the days of going to the hospital and being asleep in surgery, all that stuff is behind us.
That's great.
And so all the treatments that we do are done in the office through very minimally invasive techniques. We use a laser now to close down varicose veins that were previously treated with varicose vein stripping.
Okay.
Some veins are treated with ultrasound guided injections. And other veins are actually treated through tiny little incisions that are about 1/8 of an inch long, where we just kind of actually pull these veins out. It sounds a little creepy, but it's not too bad.
It doesn't hurt really bad?
No, actually there's very little pain afterwards from that.
See, and I like to see that the treatments generally aren't painful. I mean, they seem very simple, and you can be in and out in the same day, right?
Yeah, exactly. In fact, we have our patients come in for our procedures. They come in a few minutes early. Most of our procedures take 30 minutes to an hour and 15 minutes.
That's like lunch hour.
Yeah, and then I send you outside and have you walk around my neighborhood for about a half an hour before you even get in your car to go home. So you're immediately back on your feet, immediately back to work.
That's
now you're sore for some time, depending on the procedures.
Realistic.
But you're immediately back to action, and that's what's important.
I love that. And you actually do cover a lot of these treatments by insurance, right?
That's right. The vast majority of what we do is considered a medical problem that is covered by insurance. And for it to be considered medical, we have to have abnormal findings on ultrasound. We've shown some video of ultrasound that's performed with the patient standing. That's how we test the veins against gravity. Exactly.
Well, let me ask you this. You do a pre-screening first, right?
Some of our patients do come in for a free screening. The majority of our patients probably just come in for an evaluation, but some people don't know what's going on, or they want to meet the doctor and just kind of get a feel of the situation. So we offer some free screenings. And we've got an event coming up next week on the 25th.
Yeah, tell us about that.
And our free screening events are about 10-minute long appointments where patients come in, they fill out about a one-page history form. They tell me about some of the symptoms that they're having in their legs. If they've had anything done to their veins in the past. And I put them in a pair of shorts, take a look at their legs, and try to give them an idea if we're looking at more of a cosmetic problem, which are the little tiny red spider veins, or more of a medical problem if they're having symptoms in their legs. And if they are, then we'll probably invite them to come back for a full evaluation.
I like that. Now, what happens if varicose veins are left untreated?
The problem with varicose veins is they, unlike the common cold or the allergies, they never get better, they only get worse. Now, the rate at which they get worse varies for every patient. But they never get better, they just slowly give us more and more trouble.
Yeah, because as you said, gravity does not be our friend.
That's right.
That's good grammar, right? But it's not as you get older. And you do a lot of things in your office as well that really make you very unique. So can you talk a little bit about that to our viewers so they understand?
The beauty of our clinic is that we're completely self-contained, so you don't have to go one place to get get the ultrasound and then come back and see the doctor and then go somewhere else to have your treatment.
Right.
Everything we do is in the office.
One-stop shop.
That's right. And I'm there when the patients are being seen. So if there's any question on the ultrasound, I can come in and take a look at it, and we can actually talk about it and formulate our plans very specifically for every patient.
I think that's really comforting, just to know you're there, you know, and that it's not just somebody that's an assistant just helping out, checking things out. If there is a question and there is some kind of concern from the patient, they know they can go right to you and talk to you and get that personalized attention. And what are we looking at right now, just by the way?
Actually, this is something I want to talk about next time I come. This is treatments for spider veins. And spider veins are those little red or blue veins that we treat with little injections. This is considered a cosmetic treatment. So we're going to talk about this next time. But this is how you get rid of those little red guys that are so ugly when you're trying to look cute in your bathing suit.
Whoa, that was a good little teaser there. You'll want to catch up on that because I think that's a big thing. And I'm glad you mentioned it, is that there are medical issues, but there are also cosmetic. And we don't want to get the two confused because they have totally different treatments.
Yeah, and the beauty is many of our medical treatments also get rid of those big bulgy veins, so we get cosmetic side benefits when we get rid of those big bulgy veins.
A little perk.
That's right. That's right.
And we want to remind all our viewers how they can reach you as well.
You bet. We can be reached on the telephone at 505-848-VEIN, which is 8346, or on the web at albuquerquevein.com.
Fantastic. So simple. And again, let's remind everybody, October 25th is the free screening.
Yes.
And you said 10-minute full evaluations.
They're about 10-minute appointments, and we just review history and take a quick look at your legs and try to figure out if this is medical or cosmetic. And go from there.
It's great that you do that. I appreciate that, and I know our viewers will as well. Thank you, Dr. Cutchen,
Thank you so much
for being here.
Thanks.
And next time, cosmetic help.
That's right.
We like that. And, you know, let's talk a little bit about medicine. The best medicine, in my opinion, a little laughter. So send a ha-ha and save some tatas. It's coming up next.